Morning students. Today we will discuss about erector spiny plane block, its anatomy and all the techniques. This erector spiny plane block, it is an interfacial plane block. It is first described in 2016. It is used for the management of thoracic neuropathic pain, which is secondary to thoracic surgery. It can be given for pain due to metastasis and malunion of the ribs. The distribution of the erector spiny muscles is from neck to the lumbar region. The advantage of the erector spiny plane block is needle can be inserted away from the target organ or target site. Target of the ESP block is between most anterior and deepest layer of the erector spiny muscle and tip of transverse process. That means drug is injected anterior and most deepest layer of erector spiny muscle and tip of the transverse process. Aim of the erector spiny plane block is to penetrate most anterior layer of erector spiny muscle and deposit the local anesthetic drug between this layer and transverse process. Plane allows cranial and caudal spread of the local anesthetic drug and it spreads to multiple spinal segments. There is infiltration of local anesthesia to paravertebral space through the porous surface where the dorsal ramus of the spinal nerve lives in intervertebral foramina to innervate back structures. Erector spiny plane is surrounded by soft tissues. It is surrounded by ligaments, muscles and fat. The mechanism of action: injected local anesthetic spread in paravertebral space in multiple segments of 6 spinal segments. It reaches ventral and dorsal ramus of the spinal nerves along the sympathetic ramus communicans at intervertebral foramina level. Epidural spread has been noted. ESP block has characteristic of differential blockade. The small amount of local anesthetic reaches to paravertebral space and it blocks A delta and non-myelinated C fibers. But it does not able to block large myelinated sensory and motor fibers. Therefore, there is analgesia without motor block along cutaneous sensory block is a consistent finding of erector spiny block. Now we will see about the patient selection and choice of level. ESP block has upper thoracic and lower thoracic indications. ESP muscle is located over paraspinal gutter, which consists of 3 muscular layers. These layers from medial to lateral side are SLI, that means spinalis, longissimus, iliocostalis. The level chosen for the thoracic indication is between T2 and T5. The level chosen for abdominal pelvic indication is between T7 to T10. Cervical portion of erector spiny muscle is formed by semispinalis cervicis, longissimus cervicis, iliocostalis cervicis. These muscles insert on the transverse process C2 to C6. The ESP block is performed in upper thoracic area, which provides shoulder analgesia. Thickness of the erector spiny muscle is in lumbar level is thicker in lumbar lever. It is thicker than thoracic area, which makes lumbar ESP block more challenging. Area of blockade for ESP block. It is divided as high thoracic, mid thoracic and lower thoracic. High thoracic is between T2 or T3, mid thoracic T4 to T6, lower thoracic T7 to T12. Now, high thoracic indications of chronic shoulder surgery, post surgery shoulder pain. Mid thoracic is indicated for rib fracture, open thoracotomy, VAT surgery, thoracosternotomy, breast surgery, chronic postoperative herpetic neuralgia. Low thoracic is T7 to T12. It is for nephrectomy at the level of T8, hysterectomy at the level of T8, T10 and laparotomy at the level of T7. The drug volume is 20 cc and it can be given for hip replacement at the level of L4. Now we will see about the ultrasound scanning. Position of the patient either sitting, lateral or prone. Probe selection linear. Scan 1. Find the tip of transverse process using transverse view. Place probe on spinous process in midline and transverse process laterally. Lateral to spinous process is lamina, which is a flat hyperechoic structure. It is covered by erector spinae muscle. Lateral to lamina is tip of transverse process. It is well defined hyperechoic flat structure and it is more superficial to lamina. Mark target on the skin, that is tip of transverse process, and rotate the probe craniocaudally direction, keeping tip of transverse process on midline of ultrasound screen. Scan 2. Find the tip of transverse process using craniocaudal probe orientation, moving from ribs to transverse process. Structures from superficial to deep. These are trapezius, rhomboidus major and erector spinae muscle. Thank you.